Good morning, everyone. This is Todd Brow with Senior Insurance Marketing, and we are happy to have Bob Johnson with IHC talk about the short-term medical product. Short-term medical is one that's been, since the COVID, kind of been in high demand just because, unfortunately, people have lost their jobs and also have lost their health insurance. So this is an option for them to take advantage of it and have some coverage for their medical needs as well too. So Bob's going to go over the information about short-term medical, also training us on the new coding tool as well too. So without further ado, Bob, just take it away and tell us more about the short-term medical and IHC and all the tools that you have available.
Outstanding. Thanks, Todd. Good morning, everybody. Again, my name is Bob Johnson, Regional Sales Director with IHC Specialty Benefits. And we are taking what I hope is hopefully my goal here today is to share with you some opportunities with short-term medical and also provide some quoting and enrollment tools that can help you be really efficient and effective with your customers, not just with maybe short-term medical plans, but when open enrollment starts up in November and through December 15th, also a great quoting tool through a company that we own called the Insex Cloud. For those of you that are contracted with IHC, you probably actually have seen a lot of emails coming up about INSX. This is going to be a great platform. We actually have two different platforms that we can offer the short-term medical through. Now, this is going to be through our more organic sales platform that allows for bundling and cross-selling. But when open enrollment starts with INSX, you have the opportunity to automatically import those customers and compare at that point, is a longer-term short-term medical plan the most effective plan for them, or do they need to go to an ACA plan? But either way, you have the opportunity to offer an ACA plan, provided as long as you have your FFM user ID, which is really easy to get right now, or is a short-term medical best, and at the same time able to offer IHC supplements, because I think a lot of people have avoided the ACA, especially on the producer side, because maybe the ACA plan, we all know the compensation dropped quite a bit, and but when you can offer supplements with it, like an accident and critical illness plan or a dental plan or something like that, it really makes it now a little bit more advantageous for you as the producer to say, you know what, we can look at ACA, but we need to offer with supplemental plans that can allow you to really make the money needed to service that customer. So so like I said, we're going to do a very, very high level overview. And why do we want to look at short-term medical plans? As Todd mentioned before, during COVID, starting earlier this year, a lot of people were losing jobs, which meant they were losing coverage. Maybe they could not afford their COBRA plan if they were coming from an employer plan. They can't afford an ACA plan because they don't qualify for any advanced tax credits. Well, now short-term medical plans are the perfect opportunity to perhaps bridge that gap until they're able to get into permanent coverage. And we use, on our short-term medical plans right now, and I'll demonstrate a little bit later, we're going to use what's called the CoverMe until open enrollment plan option, because this is going to be the most cost-effective plan, quoting option for them. And what you're going to do is you're going to align that short-term medical plan with an open enrollment date, whether that's this next one or coming up January 1st, or maybe it's even further out, up to 36 months out with another short-term with another open enrollment period. Looking at short-term medical plans, with everything, what we do need to stress is that there are some pros and cons to each. Keeping in mind, our short-term medical plans are really designed for individuals that aren't concerned about pre-existing conditions. They're not concerned about, they don't have ongoing medications, they don't have planned treatments coming up, they don't need a guaranteed issue plan. They are more concerned about being uninsured, and they need affordable insurance in case of those unexpected injuries, illnesses, critical illnesses, accidents, whatever it is. That's what our typical short-term medical customer is looking to purchase. So we provide some very customizable options to help them fit their budgets with various deductibles and coinsurance amounts that we'll talk about. And also with our plans, you're able to actually visit any provider in the country with our short-term medical plans. You can go to any provider in the country that you want to go to. If they travel, if they're snowbirds, they can certainly, maybe they're up in Nebraska and they come down to Arizona, they come to Arizona for the winter. They have a plan that can travel with them because they can use any provider in the country that they want to. A service called Data Eyesight will work with the customer to provide discounts on the covered services. And with the short-term medical plans being as cost-effective as they are, with a much more competitive premium, customers are able to kind of build out better plans, and you're able to work with that customer to build out a better plan. What that does is, when I say build out that better plan, all of our plan designs out there, whether it's short-term medical or even ACA, they have high out-of-pockets that a lot of individuals can't afford. If they had to pay, $7,500 or $10,000 on a short-term plan, for example, $7,500 on an ACA plan, they might not be able to afford that. But we have the tools to help you be more consultative with your customers to build on those accident and critical illness plans, or maybe even a supplemental hospital insurance plan that helps them, that helps them provide them with some more financial protection, really. And again, short-term medical plans can be purchased all year round. Think about those individuals. They missed their special enrollment period. Maybe they purchased earlier this year a more expensive short-term medical plan. They want to look at something more affordable for the duration of the year. You might want to look at our 6-month short-term medical plans that help to lower those premiums and get ready for the ACA. Now, there are some negatives and some cons to short-term health insurance. First and foremost, very important to note that short-term medical plans are not ACA qualified plans. They do not contain the 11 essential health benefits, such as wellness, maternity, behavioral health services, outpatient prescription drugs. And it does not qualify as minimum essential coverage. They do not cover, short-term medical plans don't cover pre-existing conditions. Well, except for one plan that I have. And short-term medical plans are not guaranteed issue, and they are definitely limited in duration. These are not guaranteed renewable plans. In those situations, they can be rewritten, but they are not guaranteed renewable plans. Now, when it comes to a footprint, which, by the way, don't worry about taking snapshots of this. I will be getting this PowerPoint up to Todd to get a look at, and also this is being recorded, so it will be available later on. In most of these plans, especially in the light blue states here where you see we offer Connect STM Plus and Extend, those are states, those lighter blue states, where we can actually offer plans for up to 36 months. And Kansas, 4 months, South Carolina, 33 months. But we can still offer the plan designs, extend those out up to 36 months. This is a great opportunity. Think about those of your customers that maybe they have they're early retirees, or maybe one spouse is to join Medicare. Think about that. If they only need 17 months of coverage to get to Medicare, or whatever it is, up to 36 months, they can purchase the exact number of months to get to Medicare, become Medicare eligible. Or, like I said, maybe they just need to bridge the gap. Now, in some other states, that you see here, like Illinois through South Dakota, we need to update this. South Dakota, we're not available right yet. Plans are available for up to 6 months. And then PA, we're looking at 90 days. Now, our short-term medical plans come in really 2 varieties within our Connect STM plans, underwritten by Independence American Insurance Company. First off is the Connect STM. Now, this is more of your plain plan. It's going to be a little bit more cost competitive, premium competitive, and this provides the coverage that individuals are looking for. Again, it's going to be those critical illnesses, the accidents, the injuries, illnesses. This is perfect for individuals that don't need coverage for pre-existing conditions. They're not concerned about maternity coverage, preventive care, or outpatient prescription drugs. They're more concerned, what if something happens to me? But we do also offer Connect Plus here. Now, Connect Plus, as I've mentioned throughout, short-term medical plans out in the marketplace, ours, and also pretty much every other short-term medical plan in the marketplace does not cover a pre-existing condition. Now, we offer Connect Plus as an alternative that can actually cover up to $25,000 of eligible expenses related to a pre-existing condition. This is perfect for individuals that maybe they have a history of asthma, allergies. Maybe they've been in a mountain bike, so my buddy, I always use my buddy as an example, that has, he mountain bikes, blew out his shoulder a couple of years ago. He's otherwise fine now, but he's concerned about his shoulder being re-injured. Connect Plus could be a perfect option for him. Perfect opportunity because, now if he's on Connect Plus and he does re-injure that shoulder, then it could be covered up to $25,000 of eligible expenses related to re-injuring that shoulder. Whereas Connect STM or any other service, any other short-term medical carrier out there is simply going to exclude that injury as a pre-existing condition and provide zero coverage. So we're getting some coverage in there. And when it comes to things like asthma or allergies, think about maybe they had to go to the emergency room a year ago or so for an asthma attack or an allergy attack. Well, maybe Connect Plus is a better fit for them. Where we stand out, excuse me, I'm so sorry. In addition to our kind of highlights that you see here, we aren't charging an application fee. There is no application fee on our short-term medical plans. Some carriers are charging a $25 or $40 application fee. We are charging a $0 application fee. We are allowing you to go to any provider in the country that you want to. You're not locked into any specific network. Great for traveling. We also do not have any waiting periods for injuries or illness. Some carriers out there have a 5, 6, 7 day waiting period from the effective date for any injury or illness. If you're covered with the next day effective date, let's say somebody applies today and they're effective on the 5th of August and they have an injury on the 5th of August, well, as long as that's, depending on what plan they have, that could be considered a covered claim. And as I mentioned, we're the only carrier out there that has the opportunity for you to offer some coverage just for peace of mind to cover pre-existing conditions. Now, all of our plans include a $50 office visit copay. Most of our plans being purchased this time of year are basically in that 30 to 180 day span. Why? Individuals think they're going to be getting a job. They know they're going to be getting a job. They're in a new hire waiting period. They're waiting for permanent coverage at their employer to begin, and they just want to bridge that gap. Or they want to use our CoverMe until open enrollment because they know come January 1st, they're going to an ACA plan. Their whole world's been changed. With layoffs, maybe they're not going back to the corporate world. They're starting businesses up. Well, this is a perfect opportunity for them to use short-term medical plans so they can have 2 office visit copays in that 91 to 180 day plan. Covers the visit, the exam, and the diagnosis. That is a per policy period. Now, I mentioned also before, our short-term medical plans provide a lot of flexibility for the individual to be able to demonstrate in order to build the plan that best fits their budget needs. And with the coinsurance, now a little bit different with this. By the way, our deductibles are capped at maximum 3 per family. Now, the coinsurance, the out-of-pocket maximums that you see here are per person, per policy period, and are in addition to the deductible and the coinsurance. So, for example, if somebody was on Connect Plus with a $5,000 deductible, 30% coinsurance to a $6,000 out-of-pocket, the total exposure there would be $11,000. But I'm going to show you how you use plans to help offset that out-of-pocket max. And each plan provides a $2 million lifetime maximum. Now, within our covered expenses, and again, thinking about that customer, they're more concerned about what could happen, not what has already happened or what is planned to happen. These plans are intended to provide that coverage like for the emergency room that you see here, hospitalization, outpatient surgeries, inpatient physician visits. If they're hospitalized, physician stops by to see them, well, And that's going to be considered a covered expense as well while they're inpatient. Prescription drugs, while they are hospital confined, is a covered event, and also inpatient or outpatient X-rays, X-ray exams, lab tests, analysis that are other than wellness. These are more thinking about diagnostic or follow-up to covered treatment that they may need. If somebody, injured, they, blew out their knee, they have to go get an X-ray or an MRI or something to diagnose it. Well, that could be considered a covered expense there. Now, while my emphasis today is to talk about our CoverMe until open enrollment, really just bridging that gap for the remainder of the year. Come January 1st, they're going to want to look at longer-term, short-term medical plans, and at that point, you're going to run individual for the remainder of the year. January 1st or during open enrollment, evaluate what's best for them. Is it an ACA plan, longer-term, short-term medical plan? And that's where you're going to want to look at Connect STM Extend. Plan starting January 1st. Why? You can go up to 36. You can lock that premium for up to 36 months. But if somebody only needs coverage for 17 months, 18, 22 months, whatever, they can purchase the exact duration that they need. Again, that's perfect for individuals that say, you know what, hey, I turned 65 February of 2022. Well, perfect. I only need 14 months of coverage. Now they have a plan that will lock in that premium for them and continue through until they turn age 65. Now, after the way this works, when you're quoting, why do you want to purchase the exact number of months instead of just go out to 36 months, or just the full 36 months? Is to keep in mind that for every month of premium that's purchased above the original 12-month policy is also 1% premium. So in other words, a 17-month is going to be about 5% because they're purchasing an additional 5 months additional than the 12-month policy that's building on and extending out there. Again, that premium will be locked in. And while the premium does not reset, you're going to keep the same policy number. You're going to keep the same ID card. You're keeping everything intact. Every policy anniversary every policy anniversary, annual policy anniversary, that is, the copays, the deductible, and the out-of-pocket maximums, and the coverage period maximum benefit will reset every policy anniversary. So if somebody was effective on a 36-month plan, say August 5th, well, every August 5th, the number of copays, deductible, co-insurance, out-of-pocket is going to reset. And we can provide some very flexible payment options. Now I'm going to jump over. I want to jump over into a different screen here because I kind of want to jump into some quoting at this point. But before we do that, keeping in mind we can also write child-only plans. We can also, I also need to let you know, all of our plans are administered by our partner Loomis. They are a third-party administrator. They provide all of the day-to-day ongoing customer service, all the policy fulfillment. They issue the ID cards, which, by the way, we do issue a hard copy ID card. They provide all the claim service. Whenever there's a question, the customer should be reaching out to Loomis or accessing their Loomis customer service portal, where they can access, if they lose their ID card, they can download an ID card. They can view their policy, download their policy information. They can download EOBs. They can look at what's called deductible or out-of-pocket accumulators, claim accumulators, to see where they're at. And they can also communicate with Loomis through their My Loomis portal. But of course, their ID card does include all of the details of how to contact Loomis, the customer service, premium. It also provides details for providers. When they show their ID card, they can show, I kind of want to highlight this here a little bit. It provides all the details here, all of the details here of how the provider should submit a claim for the customer. And the vast majority of the time, like 99.5% of the time, the provider is going to submit the claim for the member. So now what I want to jump into here is, let me get over to my screen show. Let's do a new share here. I want to show you a little bit about our quoting portal. First, I'm going to show you our organic portal here. This is IHC's portal. I'm going to log in as a demo because there are some excellent tools here that provide you the means to really, be as passive or active in the quoting enrollment as you want to be. Once you're contracted with IHC, you have access, by the way, to banners. Now, for example, if you want to insert a short-term medical banner, any products that you see here, copy the HTML, paste it into your website, and, well, we haven't talked about these products yet. I am going to as we go through some quoting. But you also have link creation tools where you can copy a link, paste it into an email or a Word doc or whatever that you want to send to a customer that they can click and quote and enroll themselves. So it will be tied to your agent number. You will get credit for the sale. Important to only use your banners or links because they contain your agent number, your producer number, that you will be, so that you get credit for that sale. You also have access back here to all of your commission statements, your case status. You can actually download ID cards if you need to, copies of applications for your existing customers. You can also use a service called Client View. When it comes time to rewrite, when it comes time to rewrite the customer, you can look up a customer. I'm in as a demo, so there's not going to be any customers here, but you can look up a customer, search, and all of the details for that customer. You can actually upload customers to here if you want to. All of their details, if they've submitted an application, will be pulled in. Name, address, zip code, phone number, dependent information will all be added in the client view so that all you have to do is click on the name, click on a product, quote it. It's going to save you a lot of time, especially come open enrollment. But let's look at quoting enrollment. How do we run a quote? Well, here's what I advise. If we come to short-term medical, we look at our new quotes here. I'm going to run a demo here, for example, in Arizona. Now, notice the effective date defaults to the next day, but you can select out to 90 days if you need to. So we can start a plan here all the way out November 2nd if we want to, submitting that application. Let's look at here. Let's just look at a 41-year-old female. What are we quoting here? Well, we have different quoting options here. We can run a single pay. Let's say, for example, right now you're working with a customer that turns 65, November 15th, and they know they're going on Medicare. Well, they're going to go to Medicare. Well, actually, it'll probably start the month before. So, say on Medicare. Well, they can do a lump sum payment with coverage that ends automatically on November 1st, or whenever their Medicare starts. They can coincide it because they turn 65 during November. They can do a single payment for up to 180 days. Or we can do monthly payments. Now, we can show right now, well, we can show longer term that takes them all the way out. Look at this, all the way out until January 3rd of 2023. But we don't really want to do that right now. Let's try and save them some premium. I like to promote the CoverMe until open enrollment because what this is going to do, you always want to align your short-term medical termination dates with an open enrollment period. The CoverMe until open enrollment allows you to basically give them a plan that's going to be a monthly pay that is going to terminate January 1st of 2021. What that means is now in open enrollment, we're going to review what's better. What is the better plan to start January 1st? Is that an ACA plan? Is that a longer term, maybe an extend short-term medical plan? Maybe it's a 12-month short-term medical plan. Maybe it's a full 36-month short-term medical plan. But I'll show you some options here. Again, we're looking at a 41-year-old female here in Arizona. I want to look at the Connect Plus plans because now, hey, we may as well get them some pre-X coverage. Let's look at the 70% coinsurance. So here we have a plan that can cover pre-X up to $25,000 of bill charges, $5,000 deductible, 70% to a $6,000 out of pocket. Now this person can't get onto an ACA plan. COBRA's unaffordable, but I know what you're thinking here. Man, well, we've given them an $11,000 exposure, but what we're going to do here with this $11,000 exposure is we are going to add on what's called our Metal Gap 2. We're going to build on a $10,000 guaranteed issue accident critical illness benefit, $10,000 accident benefit that helps them to basically offset that $11,000. We're also going to build on a hospital insurance plan. Now, all of these plans, by the way, can be sold standalone. These can supplement ACA plans, another carrier's short-term plans, our short-term medical plans, a ministry plan. It doesn't matter. Every plan out there has some sort of exposure that a customer wants to offset. With the hospital insurance, you know what we've done here? Come on. I don't know why it's not pulling up here. There we go. You know, if they go in the hospital, or maybe let's build this one. I don't know why that one's grayed out, that blacked out. That's weird. We are building on, if they go in the hospital, $6,000 lump sum payment, plus another $100 per day for an inpatient hospitalization. If they have an outpatient surgery, we're building on a $6,000 outpatient surgical benefit, lump sum, in addition to some other benefits that are automatically built in here. Uh-oh. Boy, my system is wigging out here. I'm going to let it catch up here for a second. I think I have too many functions going.
Hey, Bob.
Yes.
Hey, we have some questions maybe while you're waiting here. So,
oh, good.
Does IHC have a 100% plan after deductible? Bob?
Tom?
Hey, Bob? Did you hear the question, Bob?
Go ahead. No, I did not. Go ahead.
Okay. Does the IHC have a 100% plan after deductible is the first question.
No, we do not.
Okay. Also, does the short-term medical cover maternity?
No, these are not ACA compliant plans. Maternity, now, while it does not include maternity, it does include complications of maternity. If somebody is on the plan and becomes pregnant, then, and there were complications, the complications of that maternity could be considered a covered claim.
Okay.
So, okay, so now we've selected again, go ahead.
And I was just going to tell everyone, if you have any, questions, put it in the Q&A box and we can read it.
Absolutely. We're also building on here a telemedicine. While our plans contain $50 office visit copays, which is nice, why not give them a $0 consult fee option? Where if they can call a doc 24/7, 365 for a $0 consult fee, we're going to give them a prescription discount card and also discounts on alternative medicine. We can add that. So we look here. We've built a pretty solid package. Even though we have an $11,000 exposure, we've built on, with the hospital insurance, a $6,000 hospitalization benefit plus $100 per day if they're inpatient. $6,000 inpatient hospitalization plus $100 per day. We've added on accident, a $10,000 accident and critical illness plan. We have reduced this exposure down significantly for the most likely reasons they are going to hit their short-term medical plans. And we've also built in a plan that covers the pre-X with Connect Plus for only $275 a month. For an ACA plan, this is an ACA plan. This is going to be your much more competitive option here. Now, here you can email this proposal, you can select, or you can even compare and contrast. Most of our plan designs, the way individuals want to look, you can compare the two plans, for example. And you can email this comparison to the customer. They can review and decide which one they want to offer, which one they want to select, and select their enrollment. Or over the phone, maybe you're face-to-face, whatever, however you're selling these days. Maybe you're on a Zoom call. You can actually select and you can begin the enrollment process. And again, this is all going to issue one application, one policy ID number. Now, I want to note this. While I did say our short-term medical plans do not have application fees, because there is a one-time $15 enrollment fee that you see here. This comes up quite a bit when I do this, on this product here that we added on, which, by the way, these are all available to sell standalone. Let me go back here. So now that is one process. Now another one that I like, that I want to demo here real quick, is what's called our Am I still on? Todd, am I still showing?
No, I don't see your screen.
Huh. Okay, let's do this again. Here we go. Okay, we're back.
Yep,
all right,
we're back.
So let me come to, now I also want to show you something that's going to be very useful for you, especially for those of you that work in the under 65 markets, or you're dealing with individuals that are over 65, maybe a spouse has not aged into Medicare yet, is what's called our Insex Cloud. You have access to this, and it can be 100% free. During open enrollment, there's two great things you can do with this. First off, this is going to give you access to ACA plans. As long as you bring the contracts. You work with Blue Cross of Nebraska, United, whoever that does, Ambetter, Molina, whatever. If they are on a federally facilitated marketplace, and a federally facilitated marketplace, that carrier is going to be on the Insex Cloud. So if we look here, let me show you kind of what this can do here, because now ACA is a better option during open. Let's go to a new quote here. Looks like I'm still ticking here. Okay. Let's look in Arizona, for example. Again, I'm logged in as a demo. We can put in let's just put in the same female, because now we've used the CoverMe until open enrollment, and now we're doing open enrollment period, and that individual is thinking, you know what, I don't better for me, a short-term medical plan and an ACA plan. You can now compare all of these, and you can even do a premium subsidy estimate. Hit next. Okay, this is a person making, $45,000 a year. Let's calculate a single person, nobody in the household. Hey, looks like she does get a little bit of a subsidy. Maybe she wants to take advantage of it. Let's hit next. Now, granted, I'm quoting this with today's effective date, not the future. You have all of the ACA plans. We have Bright Health. If you guys need a contract for Bright Health, please let me know and I can get you one. Cigna in Arizona, Bronze, whatever we need to do here. All of the carriers, if they are on the FFMs, if they are on the federally facilitated marketplace exchange, basically healthcare.gov, they're also going to be here. Let's select a plan here, because we can say, well, wait a minute. Well, let's select Bright Health. Works well. Hey, let's go to the next. Let's look at a short-term plan. Now, that was $300.22. Let's go to our short-term plans, which, by the way, right now on our short-term medical plans, the longest duration we have out there, the shortest duration is 12 months right now. Well, let's go to that same, let's go to Connect Plus. Let's look here. We can select this plan, a short-term medical plan. I'm just selecting a random plan here. But now we can also go to subsidies. Now, remember I added on that Metal Gap 2 accident and critical illness plan. We can do the same thing. We can select this plan and build our bundles out. Let's go to next. We can build on a dental plan. But bottom line, though, is that we can say, you know what? We don't need to go through every single plan. Let's go to our dental plans. Let's just go back to, we can add on a vision plan. So now what we've done here, though, is we've added on, now we've given them the opportunity to look at different plan designs. Maybe they've already purchased some supplements. They don't need to repurchase those. But now we can say, well, wait a minute. This Bright Health is going to be $300.82 after your subsidies. Well, a short-term medical plan is only going to be $218. This is a better opportunity for them, perhaps, to purchase a short-term medical plan, or maybe they need ACA. They know that, hey, their income is going to drop next year. They need to go onto an ACA plan starting January 1st. They can select. They can decide to enroll, or you can start the enrollment or invite the application to enroll. But what's also cool here is that you can say, let's create a private exchange. You know, you don't want to mess with it, but you want something on your website where customers can go and you can determine, you can say, well, let's just call it the SimKT Exchange. Whatever agency you want to call it. Maybe you work with associations. Maybe you work with chambers of commerce. You can label it whatever you want, Allowing the guest to enroll. You want notifications, custom branding. Again, we'll call it SimKT Exchange. Oops. These. You can add your logo. I don't have a logo to add, but you can certainly add a logo. We save this. Oops. Let's just call it Bob Johnson. There we go. Let's save. Because now you're creating your own private exchange and you can turn on and off plans. Let's say you want to deselect all and you say, you know what, I only want this for Arizona. Fine. Let's go for Arizona. You know what, and by the way, I don't work with, I want to show all these plans. I don't want to show pediatric dental, off exchange. I only want to show very specific plan designs. You can even determine, well, what plans do I work with in Arizona, Nebraska, wherever you are. You can say, you know what, I don't work with Health Net of Arizona. I don't work with Cigna. I do work with Oscar, Bright, and Blue Cross Blue Shield. You know, and I can show my which plans I want turned on and off to know what do we want them to do. You know what? Hey, I don't work with DentaQuest, so I'm not going to use dental. I only want to show Independence American Insurance Company as a dental off exchange, and then our health discount plan. So now what's cool here, we save this. Once this gets saved, we come back to our individual private exchange. Check this out. There's a copy quoting link. Let's go to a different copy that link, or you can paste it into your website. Now you have a quoting tool that will allow you basically to have a nice little branded website here. Because we haven't added any logo here, you could actually have the logo here. It's geared towards whatever you need. And now customers can just go to your website. If you need to turn it into Spanish, even customers can even turn it into Spanish. Let's go back to English. I don't read or speak Spanish very well. But now they can quote and enroll. You will get notifications. Maybe it's just intake forms. Maybe you have referral sources that you want to use with the Insex Cloud. Maybe you work with, like, say, P&C shops or other associations that just want leads. Well, you can use those leads, use this as just an intake form, so that maybe that referral just says, okay, I'm just going to get some information, name, address, maybe some income, et cetera, and that comes to you, and you have all the details you need to reach out to the customer, complete their enrollment, whatever is best for you. Or, again, using the IHC portal, you can certainly go direct here. So there's a lot of different options here that are going to be great. And what this Insex Cloud allows you to do is use this as more of a term to perm, a temporary to permanent, term to perm coverage option, so that you can be more consultative with your customers. And as long as you are using IHC products with your customers, it's 100% free. If you just do an ACA only enrollment, there is you basically purchase credits. It's a $5 credit charge to debit, I should say, a 5 credit charge, debit charge, if you do an ACA only. But for every ancillary product, short-term medical plans sold through there, you're going to get credit for it. So you're able to really use this, and it can be 100% free. So my goal today was to demonstrate to you some highlights of our short-term medical plans. Where do we use them? Excellent opportunities right now using that Cover Me Until Open Enrollment plan, Cover Me Until Open Enrollment quoting option that will allow you to get the coverage just until the end of the year, January 1st. It's going to be very competitive. We have the plans that can cover some pre-ex from a competitive posture. We can add on the supplemental hospital insurance plans, Metal Gap 2 plans, access to critical illness. Individuals are looking for that today. You can fill those plans individually. They do not have to be attached to an IHC short-term plan. Use that Cover Me Until Open Enrollment, because what we're going to do at the end of the year then, you're going to consult with them. You're going to reach back out to that customer and say, let's talk about what we want to do for 2021. Let's look at that longer term. Or maybe, again, Cover Me Until Open Enrollment. It's a very competitive premium out in the marketplace. Maybe somebody is on a longer term short medical plan with another carrier. You might want to look at them and say, hey, let's try to save you some money for the remaining of the year, save you some premium dollars. Let's get you into a new short-term medical plan with IHC that covers till the end of the year. And then we're going to look at some longer-term permanent or longer-term short-term medical plans. So hopefully I achieved that goal today. Todd, do we see any other questions coming through?
I don't have any other questions. If you have any questions, put it in the Q&A box, and we'll be happy to answer the questions for you. I mean, great tools here at your fingertips, and also IHC, a great company, short-term medical, again, bridging the gap, kind of the term to perm, individuals that are not quite 65, but the other spouse is a great opportunity to put them into an IHC short-term medical, and then once it becomes 65, then take out the Medicare supplement with them on that. So,
Awesome.
Bob, I don't see any other questions. I thank everyone for attending the webinar today. If you have any questions, feel free to give us a call here at Senior Insurance Marketing, 877-800-3080. We'll be happy to help you get contracted with IHC if you're not contracted, or if you have any questions or need some assistance with quotes. We'll be happy to help you with that as well too. So again, Bob, as always, thanks for showing these great tools to us. That's great. I really appreciate it, and always comes handy to have some great tools at your fingertips.
Yeah, outstanding. Appreciate the opportunity, Todd. Thanks everybody for joining, and everybody have a great day. I'm going to go ahead and sign off.
All right. Take care, everyone. Have a great day.
You bet. Bye-bye.
Bye.